My name is LaQuenda Phelps. I come to you first of all as a parent. I come to you secondly as an educator, teaching special education for over 15 years. I've taught all areas of special education except for visually impaired and hearing impaired. Thirdly, I come to you as a consumer for myself and a consumer for my 17-year-old son. You have to excuse me because I'm a little nervous. I purposely wanted to come to this meeting because my son is 17 years old. He started symptoms when he was late elementary. His symptoms are now manifested to where I had to literally deny him coming into my home in order to get services for him within the last 3 weeks. I literally had to refuse. I was threatened by CPS. I told them I didn't care. Call CPS. CPS was called in. Here lies the problem. My son has a high IQ. He tested on college level in every area. He goes to Henry Ford II. Because of his IQ, his behaviors are not indicative of what they normally see in emotionally impaired students. So therefore, he does not qualify for special education services. Being a special education teacher, I knew that he qualified for a Section 504. But on a Section 504, because of funding cuts, you're only limited to so many services, which to him means nothing because the only thing he gets is a place to go when he feels himself upset. What about when he can't tell you when he's upset? What about when he gets to that point, which is where we're standing now? He has the onset of bipolar, which runs on his father's side. I was in denial for a long period of time, up until more so recently. I'm going to say it again. I had to literally refuse my son into my own household as a mother to get the few little services that we have gotten in the last 3 weeks because of budget cuts and because of other people making decisions. I have had CMH in my house for the last 6 years. I've had services for him, therapists, CLS, and respite hours. We have been, for the last year, I quote, the last year, waiting on a CLS worker and a respite worker. We have yet to have a CLS worker and a respite worker in my home. Now you couple that on top of me being diagnosed in 2010 with MS and then 2 years later with Meniere's disease. One of the reasons why I had to deny him services into my house is because my symptoms, I look normal. I'm in and out of a wheelchair. Most people don't even see my illness because it's what's called an invisible illness. You don't know unless you're there to see it. Then the last year and a half, I've been found unresponsive 3 times. 2 of those times I almost lost my life. Can you imagine your 3 children coming in and seeing that and not knowing that the only parent that they have, because their father is not involved, is their mother, might die? My son has seen that 3 times. He's been denied hospitalization. I understand. He's been denied hospitalizations through access on many of times, more so recently within the last month again. My symptoms severed up so bad this time to I thought I was literally leaving this earth this time. My symptoms are only getting worse. They're not getting better. And I still don't have CLS or respite staff in my home for my son. I was just told that they're getting ready to release him from up under the Judson Center for outpatient therapy. I'm going to say it again. My son is high high function as far as his IQ. However, he does have mental illness. He's been through the Juvenile Justice Center. I was charged $189 a day. I currently owe $98,000 for that bill. $98,000 is what they charged me for a child with mental illness because they had nowhere to place him. He has been in Havenwood Hospital. He's been in Harvard Oaks Hospital. He's been in BCA Hospital. He's been in Kingswood. You name it, he's been there. It's a vicious circle over and over and over again. Sterling Heights Police Department knows all 6 of my addresses that I've been in the last 6 years. Thank God, I'm going to say this again, thank God we have a decent police department. I want to give hands up to them because they have been a blessing to my family and not harming my child. When we see so much of that going on, when we see so much of that going on in the news, because his behaviors are just that sporadic. You don't know how long it's going to last. You don't know when it's going to stop. It could go for an hour. It can go for a day. It can go for weeks. It can go for months. Yes, I apologize, but I really wanted to get here to say this. We don't need any more cuts. The school system can't help my child because he doesn't qualify for services. We're getting hours cut left and right through CMH. I still don't have any people in my home to help me. I am a single mother, have been. My oldest is 26 years. For 26 years. The state comes after me for every dime that they could get. They refuse to go after the fathers, although there's nothing wrong with the fathers. I beg you and I plead to you to go back and reevaluate the decisions that are getting ready to be made or have already been made for our children's sake. This is our future. My biggest fear for my son is he's getting ready to soon be 18 years old. It's him getting thrown out into the streets and something happening to him. That is my biggest fear as a mother. And I say this to all of you who may have children. Put yourself in my shoes. Put yourself in my shoes. I wake up every day, if it's not him, wondering if it would be me. I have yet to get services for me because I'm being denied every which way but loose because of me. I'm still trying to get services through CMH for myself. I ask you, reevaluate your decisions. Take this back to your constituents and let them know about the Phelps household, about an 18-year-old who's getting ready to be thrown out in the streets. This is my daughter. Lastly, I want to say this is my daughter, 24 years old, my caretaker as well as my son caretaker. It is not fair to her. She's fell into a major depression because she's had to take over of me as well as my son. My oldest daughter is not able to because she's severely LD. So it's only so much that she can do. When you talk about caregivers, this is a caregiver right here who's not being paid hardly nothing. I applied for Medicaid and got a spend down of $512. My home health care check, guess where it goes to? My spend down. They send a $98 check to my daughter. That's all she gets.
Not only am I my mom's and my brother's caregiver, I also work as a caregiver. I have 2 clients, one on schizophrenia, the other one has Angelman syndrome. I want you guys to keep in mind that not everyone has a big family. There's times that I work on weekends so parents can get a break and don't get paid because I understand. I have to leave work my GPA in college dropped 2 whole point averages because I had to, stay up late at hospitals because we have no services. I had no one to call. All I have is my mom, my sister, and my brother. We have no family. And the first thing that comes out of everybody's mouth is, call someone. I have no one to call. I am the backbone. So if you guys take this away, who do I go to? Because his caseworker is who I call. He has no workers. Not everyone has a big family, so you guys got to keep that in mind too. Thanks.
Hi, I'm Rita Skirvin, and I'm a mother of an 22-year-old autistic son. I can't add to the stories. I mean, we all share the story. I think everyone in this room has. And one of the first phrases that came to my mind once we started entering the system, which I dreaded the idea of it, a phrase I've had all along is jumping through bureaucratic hoops. That's a lot of what all of us spend our time doing, is jumping through the bureaucratic hoops in order to get what we know is out there for our child. Everything that Mr. Kinch described, I've seen that. We have made wonderful use of the resources that have been made available through community mental health. It's required a lot of hoop jumping, but every individual human that I have dealt with, the caseworkers, everyone has mentioned their caseworker that comes to their home, they get to know you and your child, and with them, we have pieced together services, and I want to say that we've made a success story. I have a 22-year-old son, but around age 14, and this thing called puberty, my son became violent, and I was his main target. So, when you hear too that even when hours are given, it's a matter of finding caregivers to actually fill them. Honestly, I think I've been through 40 to 50 caregivers. Some of them lasted half a day. At this point, though, about 8 years into the difficulties, we have him in his own home, but he has the caregivers to make that possible. And he is more stable now than he's been over the last 8 years. And it is due to these people here that have put together, it's not put together. And I would love to see more cohesion. We've found the pieces and put them together. And, I've been pretty lucky with the people I've encountered, that they've given me good resources, they've given me great contractors to work with, and we've pieced it together. It would be nice to see some more cohesion. I just figured this out, and I've been dealing for years with the services that we've gotten. Once my son turned 18, and I didn't know what we were entitled to, but the great caseworkers I've had, had his name in the pots where we received things. Part of the care he receives at his own home comes from DHS. Those are what are called home help hours. And what I'm realizing is that if you're looking at the big picture of the politics side of it, and it's all these different departments, it's a shame that these services that are available are so cumbersome because of the division. And everyone likes to say that they've got an efficient budget, but really the money's just coming from another pot. So the same caregivers that most of their hours are paid by what's called CLS, also they just change their timesheet for a couple of the hours and then bill it to DHS because they didn't do things like laundry, wash dishes, and those things qualify for those hours. So it's just a different pot. I'm sorry the one lady left that was here from Mark Hackle's office, because I did write him a letter. I never got a response for it. So I'm saying we're a success story because we put this all together and it's working. But now, of course, we're subject to all the cuts that's happening here in Macomb County, and it could get ripped right out from under us. The letter I wrote to Mark Hackle, and I also copied in Sheriff Wickersham, is the realization that they, the sheriffs, the police, and the hospitals, are going to pick up the slack when these cuts go through. If my son walks out the door unattended, I will assure you there will be a call to the police. Either someone is just uncomfortable with his behavior, he may act inappropriately, or even worse, someone may victimize him. So the money that's getting saved is getting cut from, is just going to be picked up by another pot, the police and the hospitals. I'm actually going to end with a joke that it was going around through email a few years ago that talked about a federal situation where someone realized they needed a security guard at this federal cemetery. So they hired a security guard. And then someone said, well, who does this guy answer to? So they hired a supervisor to supervise the security guard because he couldn't get paid federal dollars without having a supervisor. A few years later, someone realized, well, what department are these guys from? We're paying out these 2 paychecks. So they created a department. And a few years later, they realized they needed to do budget cuts. So they cut the security guard. And I think that's what we're seeing here. We've got this big administration, and it's the caregivers making $9 an hour that are getting cut.
Hello, my name's Ruth Nichols. I'm a resident of Chesterfield, Michigan. My daughter Elizabeth and I are both consumers of CMH. My daughter has autism spectrum disorder, oppositional defiant disorder, bipolar disorder, ADHD, and OCD. I have multiple sclerosis, bipolar disorder, OCD, autism spectrum disorder, and PTSD. My medications alone cost about $10,000 a month. My MS medication, the one that I take so I don't have relapses, alone costs $6,300 a month. My daughter's cost about $300 a month. The only problem that I've had with having to get my medications is having to get a prior authorization from my doctor to the insurance company for some of my medications. But what will happen to us if 298 becomes a law? Will we be switched to medications that are less effective or not effective at all? Will my daughter be switched to a therapist that she doesn't want to talk to or can't talk to? What happens if I start having mood swings? Will I lose my kids? Will I take my own life? What happens if I start having relapses with my MS? Will I lose my life there? Will I lose my sight? Will I lose my ability to walk? My ability to talk? My ability to write? Because the for-profit insurance company switched me to a drug that does not work for me or my daughter. CMH has helped my daughter because she needed to be tested for emotional impairment. I had to fight her home school district, L'Anse Creuse Public Schools, and her home school, Carcanord, to get her tested. But her second grade teacher, Mrs. Devich, and I were her advocates. She is now in Maple Lane Elementary, and instead of discipline problems and half days, she is going to school full days without any discipline problems because of a good medication regimen. But all of that will go away if you privatize mental health. Her medication regimen will go away, so will her good behavior. I need CMH because I have case manager services for her, a therapist for her, and a psychiatrist that she adores. If you privatize, I won't have that. I have a therapist and a psychiatrist that I like. If you privatize, I won't have that. And then what happens? Who picks up the tab? Who is going to pick up the tab for my kids? One of them is going to be in a mental hospital, the other one's going to be in foster care. Who's going to pick up the tab for that? Are all you people out here, the taxpayers of Michigan, going to be picking up the tab for it? You sure are. I won't be. Because I'll be somewhere in a mental institution or dead. Because you privatized or allowed the privatization of the mental health system. But you know what? I will fight. I'm one of these people out here who will fight. I will fight each and every one person who would vote for the privatization. I will picket Lansing. I will go to each and every one of your offices, and I will strongly urge you to vote no on 298. I will go to the governor's office, and I will strongly urge him not to sign it into law. I will urge him to veto 298 if it gets past all you. I will fight this to my dying breath.
Hello, my name is Helen Warner Bell, and my husband and I are in a quandary, to put it mildly. We don't like what has happened to our mental health system in Southeast Michigan in the past 2 years, but we live in dread of what our state is planning for mental health services, i.e. turning it over to for-profit HMOs. We feel as if we're about to be thrown from the proverbial frying pan into the fire. Let me explain. For the past 16 plus years, my severely medically, cognitively, and behaviorally challenged son, now age almost 46, has been living in his own home, participating in his community, and doing this with the help of loyal, well-trained 24-hour staff. Before that, he struggled in his center school program in the behavior room and was kicked out of just about every program set up for people with disabilities, including a camp where he was physically injured. Because he has no speech or other means of communication, he cannot tell me or anyone what sort of mental and or emotional abuse he may also have suffered. In other words, none of the slots set up for people with severe disabilities could accommodate him. Fortunately, we finally got a social worker, AKA supports coordinator, who was with us long enough to understand our challenges. At that time, our services were directed by Community Mental Health System. Working with our worker in Community Mental Health, we set up my son in his own house with 24-hour care. Because of his sometimes violent emotional outbursts and severe food restrictions, it was clear he needed to live alone. This may seem an extravagance to some, making a cursory look at the situation, but for those of us who lived through the trials and tribulations, it was clear this was a necessity. While staffing his home has always been a challenge, we had finally settled down with 3 mature, experienced, reliable staff. My son was accessing the community with their one-on-one assistance, socializing with his staff and their friends and families, and even participating in a volunteer delivery job. Things were really pretty good, comparatively. Soon after my son moved out of our house into his own home at about age 30, we were transferred to another agency along with our supports coordinator, and all continued to go along reasonably well, finding qualified staff being our main challenge, educating my son's medical providers being another. But for years now, he's had doctors who have learned how to work with him and how the rare syndrome he has affects him. Then, 2 years ago, bad things started happening. First, our state government decided to rebase funding and cut the general funds so that Southeast Michigan, where services had been delivered by enlightened, person-centered planning, took a big hit. For us and others, that meant a cut in my son's budget that goes almost completely to pay staff. Thank you, Lansing. Then, the federal government passed the mandatory overtime law for caregivers without supplying any more funds monies to fund it. Since all of my son's staff work overtime, that hit us hard. We, my husband and I, are currently paying the overtime ourselves, and as senior citizens who foresee our own care needs in the not too distant future, that is frightening. But the law is the law, and we are law-abiding citizens. The solution to this may seem simple, just hire another worker. I've been trying since January to do just that with no luck. There has been little interest in working a difficult job for just over $9 an hour, and what interest there has been from people who lacked maturity and reliability. If I ever do succeed in hiring another worker, our current loyal, experienced workers will have their hours and consequently paychecks cut substantially. So thank you, Washington, D.C. And now our state government wants to wash its hands of the moral responsibility of serving our most fragile, vulnerable citizens and turn us over to for-profit HMOs. Where would the profit come from? More cuts to my son's staff's salaries? Politicians are talking about raising the minimum wage to $15, and God knows good care staff deserve it, just as they deserve overtime. But please don't offer pie if you're unwilling to provide the ingredients to make the pie. Otherwise, it's just pie in the sky. So, for-profit HMOs would make their profits and still improve mental health services? Just how would that work? How could I ever get them to understand my son's complicated and extensive needs, or even agree to serve what they would deem as an expensive client? How could we hold them accountable? Would they even be Michigan-based? How would I contact them? Through a cost-saving telephone tree? What we need is a for-people government system, a local county system that is close to and accessible by the people it serves. We need a system that recognizes that serving people with complicated needs is a hard, messy job, but that those of us who are able and have the moral responsibility to do it properly should do it. To cut budgets with the attitude that if people really try, they can manage with less. Just be creative is reckless and I dare say cruel. And I better stop now. Thank you.
Let me begin that my name is Natalie Bohane. I'm on the autism spectrum. I speak on the behalf of those who have autism special needs, as well as those who have psychiatric conditions one way or another. Good evening, ladies and gentlemen, legislators, candidates for political office, and so on. It feels like Les Miserables with Hear the People Sing. If Lansing does privatization, they're not listening to Hear the People Sing. Regardless if any one of us is liberal or conservative, privatization will do nothing more than bring forth negative consequences for special needs and mentally ill individuals, especially those who cannot afford to pay beyond what the insurance requires them. It would lead to impoverishing that population. Just as I have difficulty getting the services for the past 2 years that my mother had to work long and hard to get my foot in the door, the same would apply with others with special needs and psychiatric conditions. You know, what I'm experiencing right now, as far as services go, when I'm having difficulties with, you know, with privatization, it would only make matters worse. And what will happen if Lieutenant Governor Brian Colley's own daughter, Riley Colley, when she turns 18, how will she be affected by it? It will only make matters worse, and what I'm experiencing right now is what she will be experiencing when she turns 18. And I tell you, whether I have a high IQ or not, privatization will exacerbate matters. I will not have any way to obtain the services necessary to live in a productive life. It costs more to help an Audie like me, you know, according to statistics. I will end up on the streets, and if I don't get help, I might end up in the institution, the psychiatric ward, or the jail cell, which are dismal places which I shouldn't be, and the same would apply to those who have special needs, including autism and psychiatric conditions. I mean, these are very inappropriate places. I mean, it's making matters worse in terms of how they behave and things of that nature. Are you with me? I don't want to end up in a jail cell. I mean, it would just break my mother's heart, if you will. And I mean, that I would be like an animal, which I don't want to be. I will not have the financial means if Lansing privatizes my services to insurancers who will also feel the burden of paying for me. I mean, this is something that, you know, not just the legislators of Lansing have to hear this, but also Governor Snyder, given the fact that he has a lieutenant governor whose daughter has special needs. I think it's kind of unfair. And I tell you, doing so would accelerate further the death mentality, or as Pope St. John Paul calls the culture of death, for families and their loved ones with special needs and psychiatric conditions. Thank you for listening and for your consideration for maintaining of those who are vulnerable, who are, as Pope Francis puts it, masterpieces of God's creation. Thank you. Anyone care for a standing ovation? If I am in a cucumber costume, I would be in a pickle.
My name is Maureen Kiak, and I'm the lucky mom of an amazing young man named Drew. Drew Rocks is his unofficial name, because he really, really does. I began calling him Drew Rocks when he was a few years old. The story goes like this. When people would ask me how my son was doing, can he hold his head up? No. Can he roll over? No. Can he walk? No. Can he talk? No, not yet. Does he feed himself? Nope. Does he sleep through the night? No. You get the idea. I didn't want to focus on what he couldn't do, so instead we focus on what he does. He rocks. Drew is now 15 years old and has a diagnosis of spastic quad, cerebral palsy, and dystonia. He has made gains over the years, but is still totally dependent on me and others to perform all of his activities of daily living, to keep him safe, fed, comfortable, and happy and healthy. I'm appealing to legislators to not cut funding for the more than 300,000 Michigan residents the public mental health system serves. Life happens. Life happens even faster, louder, bigger, and more desperately for families of loved ones with special needs. Drew is going through life right now. He is uncomfortable and at times inconsolable. His bones may be growing and pulling on his muscles to the point of severe pain. He may have a migraine, stomach ache, hurt feelings, or spasms. Something might be scaring him. Either way, his nervous system's in chaos. I have no idea because he can't tell me. I try to figure it out based upon the lifetime of experience with him and undying love and devotion to him. We're a team. We adapt, adjust, keep smiling, and moving forward. We get things done. In that respect, we're no different than any or all of the people in this room tonight and the other 300,000 Michigan residents the public mental health system serves. We receive PT, OT, and speech and respite services through Macomb County Community Mental Health. Thank God. The services he receives immeasurably improve his quality of life and strengthen his body. They stimulate his brain and build new neural pathways so he can maintain and build on skills that he has learned. Through no fault of his own, Drew needs help with every single ADL, including positioning, feeding, changing, bathing, grooming, entertaining, and others. CMH provides the services and supports we need to help Drew reach his goals, remain safe, loved, taught, valued, and inspiring to those lucky enough to meet him. If not for the CMH program to provide resources for Drew and for us, he would not be as successful. Some might think successful is an interesting word to describe a 15-year-old boy who needs everything done for him in constant 24-hour care. But he is. He has had one surgery in 15 years, no pneumonias, occasional sinus infection and virus. Even though his immune system is compromised and lack of speaking and movement should lend to severe physical health problems. He has no orthopedic issues, even though most people with his diagnosis are severely contractured. The services that Macomb County Community Mental Health provides allows us to not only keep our family intact in our loving home, but keep his bone density strong, his respiratory system manageable, his range of motion adequate to prevent contractures. He needs the services he receives. His life depends on them. You could look at it like a return on your investment. Our kids and loved ones are not typical. They don't fit into a convenient mold. They don't fit into traditional healthcare plans. They each have specific and unique needs. They will not be cured or rehabbed with 60 visits per lifetime per condition or a certain number of visits allotted by a utilization team. There is no magic number of visits to a specialist or clinic that will fix them. They can only try their best every day to reach goals while fighting their minds and their bodies every second of every day to complete the simplest of tasks and remember how to do them the next time. We need to find a solution. We can help you. We get things done. We juggle, manage, negotiate, and navigate our way through the unknown every single day. Cutting funding, privatizing the mental health system, and transferring these life-changing services for our loved ones would be a disaster. Assisting the most vulnerable of our family, friends, neighbors, and loved ones is expensive. More importantly, it's priceless. Just ask us. We're telling you we can't afford you to not assist them. Thank you.
Good evening. My name is Monique Stanton. I'm the president and CEO at Care of Southeastern Michigan. We're a nonprofit organization that focuses much of our work on substance use disorders. And I wanted to point out that substance use services are a critical part of our community mental health system. Not only do I have a professional passion for this work, but I have been personally impacted by substance use disorders. Many of you know my mother is in long-term recovery from a heroin addiction. She was absent for most of my childhood. Unfortunately, my biological father, Kenny, did not make it. He abused drugs and alcohol for his entire life. He likely had a co-occurring mental health condition. He was in and out of prison. Unfortunately, he did not access the much-needed critical services that are available today and died too young from his addiction. While I recognize that our system is not perfect, I do know that most Medicaid health plans would not have been proactive in reaching out to somebody like my biological father. He wouldn't have been able to access those services very likely. While I recognize that we need to continue to make very much needed improvements, our current system is proactive in finding people like Kenny who don't necessarily fit the most ideal criteria and are difficult to treat. Our system also works with law enforcement, with education, with parenting groups, with the faith-based community. We've been proactive in adding recovery homes, peer recovery coaches, bringing much-needed naloxone to our first aid responders and our law enforcement to stop people from dying from heroin addictions. And right now, if we privatize this entire system, it is very possible that these critical services and collaborative efforts won't exist. I challenge you to recognize that our state budget is the single most important thing that shows us as citizens and you as legislators what our values are, who we prioritize, and what we prioritize. And so as you take into account these critical decisions, I ask that you keep in mind people like my father, people like the children here today, the parents that have spoken, the caregivers, and so the most vulnerable are consistently at the forefront of all decisions that we make. Thank you.
My name is Bob McCreevy. My wife and I are full co-guardians of a disabled son. This year, we traveled to Lansing and testified both before the House and the Senate Appropriations Subcommittee. And probably by the time that we were done testifying and got out of the room, our testimony had either hit the round file or the delete button. Nothing changed. We witnessed a little girl that went up to testify, and she was so disabled that she was on a walker. It took two people to help her get out of the walker and get seated at a table in front of the microphone. It was a pitiful thing. If you had half a heart, it would bring you to tears to witness this. We've been assured here tonight that our testimony will not be deleted. It may be ignored by the people in control over there in Lansing, but it will not be deleted, and they're going to have to live with the consequences. Now, I have a son in the community mental health system. He has lived independently for 30 years. Due to budget cuts from Lansing, he is now back in our home. Governor Snyder and the legislature are hurting the disabled. My son was in a portable supports program and a shared apartment program with a 90% success rate. He was stable beyond belief, beyond all exceptions for 12 years. He received treatment costing about $1,800 per year when he was stable and enjoyed a $4,200 per year housing subsidy. Budget cuts from Lansing closed the perfect program and dumped 30 recipients to the street. Why would you close a program that saved money? Now, the gentleman that wrote this program and managed it and gave us 12 years of peace in our family is standing here in the back. His name is Bruce Dutton, and I thank you, Bruce Dutton, for the 12 years of peace that we had. Our son is now being treated in the revolving door of court-ordered commitments and premature releases. The third time this year he was hospitalized. He was so sick, both mentally and physically, that he almost died. He spent 5 days in intensive care. Closing a perfect portable approach program, which treated our son for $1,800 a year, versus $180,000 to date in court costs, just does not make sense. This hospitalization sounds like we need a CPA that can add. Where is the savings? Governor Snyder's budget plan. Cut the budget to community mental health. Cause community mental health to fail. Use the planned failure for an excuse to privatize, integrate the mental health funds. Budget cuts hurt our mentally ill son. The result of the Governor Snyder's budget cuts, our son lost affordable housing, lost a $4,200 housing subsidy. He is back in our home after 30 years. It closed a perfect program, lost CLS workers, community living support. He was denied treatment at one time when they couldn't hire enough staff in the program to take care of him, to where he decomped 75% below his base. This has just created more helplessly homeless people out there in the streets. Governor Snyder's plan to privatize/integrate the $2.2 billion mental health budget. It's cut 40% off the top. Turn the remainder over to private industry, the insurance companies, to take their cut, a third-party profiteer. Probably another 20 or 30%. That's not leaving much of a $2.2 billion budget. This is an illusion of progress, a crisis in the making, another money grab that will close the doors to community mental health as we know it today. I am afraid to die and leave my son at the mercy of a broken mental health system designed to fail. I am afraid to die and leave my son at the mercy of 5 insurance companies that are profit-driven. Now, to me, it is so simple. In one election, if we go out and vote in our own best interest, this can all change. Thank you.